I'm really pleased to indicate that the Department of Health, through the Minister's Office, has revised the guidance for visiting across hospitals and indeed in care homes. And that means from tomorrow, Friday the 7th, we will be able to permit, in a phased way, more visitors to all of our health and care settings. And that's really positive because we are really keen to facilitate families to have the right to visit their loved ones, and because that's really important for them. It's a human right, but we must always do that in a risk-assessed and very balanced way. And that will be a key message that I would want the public to be very mindful of. The visiting will, in most occasions, enable one person to visit every day, likely for an hour, in the majority of our general wards. That's in acute hospitals, community hospitals, mental health and learning disability facilities. There will be some exceptions. For example, a children's ward, there will be the allowance for 2 people to visit. We will ask those, for example, mother and father, to rotate in and out of the room themselves rather than having 2 persons, because in a number of our locations the environment is quite small and social distancing will always be really important to maintain. In maternity services, a birthing partner can accompany their partner to the labour ward, be with them during the birthing period and immediately after. And indeed, one birthing partner or other significant member of the family can visit antenatally and postnatally. We would always ask that in an outpatient facility where some of our environments are very tight in terms of distancing, if at all possible, could an outpatient, the person who's attending the clinic, come alone. However, in some exceptions, for example, the person might need mobility support or have problems with memory, we will permit that person to be accompanied. But to maintain effective distancing, please only come alone if you can to outpatients. And the same applies in our emergency departments. We would also want to say that there will be exceptions in, for example, cancer centres and also in renal units where people are more vulnerable, and it's important to maintain that safety, and there may well be more limited visiting. Always risk assessed, communicating between the manager of the ward and the individual family and person who's a patient themselves. So, as I say, in the majority of cases, and our guidance, which you'll see on our website, will reflect this. It will be 1 visitor, 1 hour, once per day. But there will be exceptions, and a situation can change very quickly given the COVID risks. And we would ask you to maintain close observation of our website and talk to the relevant managers of the care facility that you're aiming to visit. I would also then want to say that visiting, we're very pleased to say, will also open up in residential and nursing care homes across the health and social care system. And again, that's really, really important for us, but also that balance of the right to visit and the risks around visiting. And the COVID secure environment is something that we would ask the public to maintain. Please always remember the 5 key practices in terms of ensuring a COVID secure environment. And they are wearing a face covering, washing our hands frequently and ensuring good personal hygiene, wearing personal protective equipment when it's recommended and in the right way, good ventilation, and effective social distancing, 2 meters. So finally, I would like to say that when you read the care home guidance, those of you who will be visiting in care homes will be permitting 2 visitors in a care home from tomorrow. Every visit will be risk assessed, and that will be up to twice per week at present. As I say, the visiting guidance will be in a phased way, review every 4 weeks. And it's tremendous now also to see that in care homes there will be opportunities for residents to go for a drive with a family member or visit, for example, a family member's home. Again, COVID secure, always individually assessed. It should be part of a care home resident's care plan, part of a dynamic risk assessment on every occasion. And when that works well and is safely facilitated, it'll be a really important positive step for residents of care homes. So It's a really important time across health and social care. The risks are lower than they were, but can change very quickly. And if there's an outbreak in a hospital or in a care home, or indeed an increase in cases in the local community, that will have an impact on visiting. And we will work very closely with the public, who we are grateful for your continued support, and all our staff who continue to be tremendously supportive of visiting, but always conscious and aware of the risks that happen. Thank you very much.